Hello everyone, I'm Dr. Dolly Chawla, working as a fetal medicine consultant at Vardhan Fertility, Panaswadi, Bengaluru. Today I'll be talking about one of the most important scan in the pregnancy, which is called as a anomaly scan or a mid-trimester anomaly scan or a TIFA scan, also called as a target scan. It is generally performed between 18 to 24 weeks of gestation, where we will see the structures of the baby, because by this time the organogenesis and the structures that has to grow has finished. So we see various aspects of baby as well as the maternal aspects. First thing we see is the growth of the baby, where we will see the head circumference, the abdominal circumference, and the femur length, that is the thigh bone length, and we give an estimated fetal weight for that baby. So we will compare it with the gestational age of the baby, which we have assigned in the first trimester scan, which I have explained in my previous video. So after that, we will see the structural survey. So we will see baby from top to bottom, from head to toe. It starts from the head, where we will see the skull bone, brain, structures in the brain. We will see face with the eyes, nose, lips, palate, ears, neck of the baby. We see the chest of the baby with the lungs, heart, abdomen of the baby with the umbilical cord insertion, two hands, fingers, two legs, feet, spine and kidneys. We will do a basic study of the heart, which is called as a basic echocardiography, where we will see the structures of going into the heart and the blood flows going into the heart, coming out of the heart. And there is another variation of it, which is called as an advanced fetal echocardiography, where we will see the heart in detail. There are certain case scenarios where we do this kind of detailed study of the heart, advanced fetal echocardiography, like in the case of maternal diabetes, or if the mother is having any history of heart defects, or if the previous baby is having any history of heart defects in certain kind of medication injection, drug injection. And sometimes it can be done when we do the scan and we find out that there is a cardiac defect, and we extend our study from basic to advanced fetal echocardiography, where we will see the structures more in detail and take the measurements of every structures. So this is about the structural survey. Sometimes when we find some kind of particular defects which are pertaining to particular kind of trisomies or chromosomal abnormalities, usually trisomy 21, 13 and 18, which are the most common prevailing chromosomal abnormalities amongst the population. But usually trisomy 13 and 18 will show defects in the first trimester itself. Sometimes the subtle defects may be missed in the first trimester, and we can find out them in the second trimester. So testing will be offered based on that. Also, the third thing we see is the soft markers. Now, soft markers itself is not a defect. They are the signs, they are the clinchers for chromosomal abnormality. We generally see 8 to 10 soft markers in the baby, and the presence of it does not indicate abnormality in the baby. So now these soft markers will be also present in the normal babies, but the presence of one or two soft markers will increase the risk for chromosomal abnormality, and in this case scenario, we will offer a evaluation of the baby in the form of invasive testing or direct testing of the baby. So I will not taking in detail about this, but I will tell you in bit that when we see this kind of markers which are pertaining to more chromosomal association or genetic problems, we do a needle test, a definitive test, that is invasive test. We put a needle inside the mother's belly, and surrounding the baby there will be a fluid which is baby's urine. So we test it and we get the baby's result. Okay, so the pregnancy can be stopped or terminated if the results are abnormal. So this is about the soft markers. Also, if the mother has not done first trimester screening, or if she has missed the first trimester screening, then we can offer another kind of chromosomal risk assessment, that is quadruple marker blood test, which is second trimester. So this second trimester quadruple marker blood test combined along with the anomaly scan will give us about 85 to 90% accuracy. Let me tell you, scan is not 100%. Scan is only 75% accurate. When we say the baby is looking normal structurally, we mean 75% the baby is fine. Regarding the chromosomes and genetic associations, we cannot rule out on scan. Hence, we offer this kind of screening test. Suppose if mother has done NT scan, double marker blood test, anomaly scan, and we do second trimester quadruple marker blood test, we combine all the four and we call it as a sequential screening. Such kind of screening will have 90 to 95% accuracy. So this is about the screening test for the chromosomal abnormality. After seeing the soft markers and all, we see the uterine nitrate Doppler, that is the maternal component, where we will see the blood flows going from mother to the baby, which is uterine nitrate Doppler. If it is raised or altered, it increases the risk or the risk of preeclampsia, the mother having history of preeclampsia, or the chances of mother getting high blood pressure later in the pregnancy, or the chances of baby being small, that is called as a fetal growth restriction later in the pregnancy. So these things will be followed up subsequently based on the findings of the scan. Also, we see the cervical length, endocervical length, which is the birth passage of the baby. And in that case, we do a transvaginal sonography or endocervical scan. It is a scan in which the transvaginal probe, the scan probe, is inserted, a tip of it is inserted into maternal vagina. And let me tell you, it is absolutely safe scan. It does not harm the mother, does not harm the baby, and it does not lead to abortion or any kind of bleeding. It is absolutely safe even when there is a cervical stitch. So this kind of scanning is very mandatory during this period of gestation, because if the cervix is short or if there is any abnormality in the cervix, it is the best time to put a stitch in case if you have missed in the first trimester. So that is about the endocervical scan. And now, after seeing everything about the baby and the mother, the other thing we see is the fluid surrounding the baby, which is an amniotic fluid. It is an indirect clincher that baby's kidneys are working well. Also, we see the placental localization. Where is the placenta located? And if it is located close to the cervix or birth passage, it may hinder sometimes the mode of delivery if it stays down or lower down close to the birth passage later in the third trimester. So this is all about the anomaly scan, which is the most important scan in the pregnancy. We should not miss it. So after this scan, based on the findings, based on the baby's growth, based on the uterine nitrate Dopplers, and if there is any abnormality, the next subsequent scans will be offered based on this findings. And usually the growth scan is offered at around 28 weeks, that is 7 months, where we will see the three basic components, because we have already studied the structures. Sometimes the late coming abnormalities can still come up, like in the brain, in the heart, or even in the kidneys. So we see a structural survey, we see the growth of the baby, we see blood flows, Dopplers in the baby, and we see the amniotic fluid. So this is about the growth scan. It will be offered every 4 weekly, that is 28 weeks, 32 weeks, 36 weeks, sometimes 37 weeks, based on the parameters when we do the subsequent scans. So this is all about the scanning in the pregnancy. Thank you.